Move up to the femur. So I'm going to clamp the femur down to the table. Can I go a little tighter?
Yep.
The amount of padding that I use on the leg is dependent on how the patient feels. Now, in doing these bone procedures, she doesn't have to be just supine. She could be lying on her side, or she could be prone. This way we'd flex the bone in a different way. You all right? Now I'm grabbing above the knee this time, above the knee. Pressure on, pressure off. Strange feeling, huh? Mm-hmm. Feel that femur bending? Mm-hmm. Isn't that weird? And again, if I want to affect the outside of the femur, I'd rotate her internal rotation somewhat and pull her towards me this way. Patient's response, that's a guiding light for me. So if they have pain in the femur or pain in the shin splint, when we do the procedure, we actually want to reproduce the pain. As we're doing the procedure, we're reproducing the pain because that means we're targeting the tissues that we want. We're targeting the area that has this non-vascular edema. Who's to say a condition like when we have degeneration of the hips, osteoarthritis of the hips, and that pain you have in the hips, we know the cartilage is lacking on the joint surfaces. We know the joint space is decreased, there's roughening in the bone. But who's to say some of this pain is not from this non-vascular edema in the subchondral bone? Who's to say that this pain isn't, some of the pain in degenerative arthritis in the hip is not due to this edema in the cancellous part of the bone, the compact just underneath where the cartilage on the joint is. There's a stress on the joint, as you read before this, as you're aware, when the nerves are stressed, the nerves and associated connective tissue produces proteoglycan. And why can't the proteoglycan be in the bone matrix just underneath the cartilage of the joint due to this stress over the years? Perhaps by releasing some of this non-vascular edema and the blood flow increasing, maybe that would in fact reduce some of the pain in the hip. Well, how can we tell? Well, if somebody has a chronic degeneration of the hip or chronic hip pain that's not really in an acute phase, it's really not inflammatory, but it's this other kind of a condition, we could try a procedure to see which way they respond. So we're going to try this procedure on this hip. Okay, put this leg in, take this leg out. Now this time, slide down a little bit. She's being stabilized just below the groin. We can let this down now. Can I go a little tighter? Mm-hmm. You all right? I haven't got this quite right, sorry. You all right?
Yep.
Quite often you feel that hip pain deep inside here for you, right inside there. That's where the degeneration. Sometimes you feel it on the outside of the pain, hip. Let's suppose she feels it more on the inside. So the pain, the hip joint, as you know, heads of the femur, the medial aspect of this heads of the femur, are that close together. It's quite close together. So that hip comes up here, the neck of the femur, and then the femur comes up, the neck of the femur, and the ball is actually quite close, more close than what people think. Can I go a little tighter? You okay? You gotta watch out for the response. Pretty wild, eh? Pressure on, pressure off. So I'm attempting to flex the bone from the neck and superior, from the neck and up. Pressure on. Her response means everything. You all right? Pressure on, pressure off. Pressure on, pressure off. I can change the angle. Suppose she has the pain on the outside of the hip, degeneration with pain on the outside of the hip. We're just going to switch legs here so it's more easy for you to see. No flexing in there?
Yeah.
Pressure on, pressure off. Flexion in the hip. We're trying to get the hip to flex, the actual bone to bend somewhat, to stretch the periosteum, and maybe actually change the shape of the bone somewhat, temporarily, to affect the blood vessels inside the bone itself, underneath the cartilage. Similar procedure. Sports injury, for example. Someone has a chronic pain in the neck. Athletic type has a chronic pain in their femur, the neck of the femur, perhaps a latent fracture in the neck of the femur that happens at times, or this kind of a chronic pain in the neck of the femur. Perhaps a procedure like this might give them some relief.